Where are the areas geographically of growth for you, outside presumably of the U.S. and Western Europe?
We have a very large and growing business in China. So China has just entered now one of our top 10 markets, and last year it grew 24%. So the Chinese government has made a massive commitment to improving health care among rural Chinese and among the urban Chinese, and so we see that as a continued growth area. Another area is Russia. Russia has a problem. Russia has a declining population, and the government in Russia has made the commitment to improve access to health care in ways that will reverse that population decline. So there are many developing countries where we're investing quite heavily as growth areas.
In markets like that, isn't it a very different business? Those people are paying for their own medical care for the most part.
Yes, it is. A lot of the drug payment in those countries is self-pay. So you have people paying out of their own pocket. At the same time, you think about the economic growth in China and the absolute size of the population. We have many drugs, many innovative drugs that we have launched in China that are freely paid for by many of the Chinese who will pay out of pocket and they want the drug.
Right. How about Africa?
I see Africa as the next set of emerging markets. So probably not now, between now and the next 5 years, but we have to start building infrastructure now in sub-Saharan Africa, countries like Nigeria, like Kenya, because those economies are growing at 6 to 7% per year. They have healthcare infrastructures that are at their infancy, and you're going to see an emerging middle class in those countries. Probably not this year and the next 5 years, but in years 5 through 15, I see Africa as a tremendous growth opportunity for Novartis.